stage 4. So pag stage 4, yan yung latest stage ng cancer. Kumalat na yung cancer from the primary side. She has breast cancer, it may have spread to typically bone, lungs, possibly brain. Talagang tinutulong na lang nila yung mga ang PDR class. This is normal. Picture na to. Para ma-report ko kay Dr. Giyang na
si Kai ata to. Post tayo. Post tayo.
may ma-report naman ako sa
Patay ka na yun.
May attendance ba? May attendance bang umikot kanina? So first 4 stage TAC, PL. She already underwent bilateral mastectomy, she underwent radio and chemotherapy, pero persistently nag-worsen pa rin yung condition niya. Her tumors continue to spread and her tumor continues to grow. She was admitted for difficulty of breathing, secondary pneumonia, and also because of pulmonary metastasis. So let's say that when they did the chest CT scan, mas marami pang metastasis tumors kaysa sa lung tissue. That's why nahirapan na siyang huminga talaga. This is her third admission due to difficulty of breathing in the past 2 months despite oxygen support. Her partial pressure of oxygen is low at 60. Normally at least 80 yan. For most people, 92 and above. So despite oxygen support through nasal cannula or face mask. Married with 2 daughters ages 6 and 3 years old. Final slide. So question, does PL have a right to refuse medical management? Pwede ba pagdating niya sa emergency room, lahat ng gusto gawin ng doctor niya, i-refuse niya? Okay, what do we call that? A characteristic that's her inherent right to the autonomy. She can refuse. Sasabihin ng doktor, bakit ka papunta dito sa ER? Wala naman pala kaming gagawin sa'yo. But does she have the right to refuse selected interventions that she chooses? Dok, pwede mo ako i-IV-han, pero wag mo akong gagawin to. Wag mo ako i-intubate. Pwede? Who says no? Whatever the doctor says in the emergency room should be followed. Ang masusunod yung doctor, hindi yung patient. Tama? She has the right? Everyone agrees here? Yes. Do PL's relatives have the right to make decisions on her behalf?
If she can't make the decision, she's in a coma and she was there, then...
But what if she's still fully awake? She's in the right mind, she's not disoriented. Can the relatives make the decision? Dok, wag kang makikinig kay PL. I-intubate mo yan kung kinakailangan. Kami nang bahala. Pwede ba yun? And the doctor will not get intimidated by the relatives. Dok, pag namatayan, konsensya mo yan. Kahit ayaw ng PL. Tama ba? So do the relatives have the right? Again, only if she cannot make a decision for herself. That's the only time the relatives will be able. What if the relative's decision contradicts the wishes of PL? Again, si PL ang masusunod if she is awakened. That's the purpose for our advanced directives. Hirap naman dito. So the advanced directives started about 1960s, 1970s when we started having mechanical ventilators and all these machines that could prolong the lives of our patients. Some patients were thinking doctors would keep them on life support rather than letting them die with dignity. Yung ibang patients naman, ayaw pala ng mahabang buhay, malapit na ako mamatay, bakit mo pa i-prolong? You give me 10 extra days of life, but these 10 days are very poor quality of life because I'm stuck in the ICU, I'm feeling terrible, I'm hooked to a mechanical ventilator and all these things. So that's why advanced directives generally started during this time. I generally have 2 advanced directives. The first one is called the living will or instruction directive. Do not confuse with the will that our lawyers make for estate or passing on of properties and estate. Ayan yung tawag dyan. Basta will din ang tawag dun eh. Basta ito, living will, ito yung instruction sa doctors. So a written or oral account by a decisionally capable individual addressing future treatment during a period of incapacity. Contain information about what decisions should be made or how. About values, goals of therapy, preferences for care in a variety of clinical scenarios. Then there's another kind of advanced directive. We call it the proxy directive, also known as the healthcare power of attorney. Although we don't need to involve attorneys, it's still called the healthcare power of attorney. So a written oral statement designating a particular family member or other trusted person to act as the future decision maker if the individual making the designation becomes incapacitated. Indicate the individuals who will make decisions on behalf of the patient should the patient lose competence. So upon coming to the ER, should we get advanced directives from PL? We should get a living will from PL para malinaw. Tama? Kung what she's willing to undergo. Should she get a proxy directive also? That's her choice siguro. Kasi later on, baka maging unconscious siya. Okay? Kasi baka pag unconscious na siya, i-reverse naman ng relative niya yung pinirmahan niyang first na living will. So it's her choice if she wants to get a proxy directive or just follow my living will. Yan na yun. Okay? Wala nang iba. So just so you have some idea about what the things that we put in our advance directive. So what happens if PL is severely anemic? What do we usually do? Probably transfuse her with blood. These are things that some patients refuse. What religion?
Advance directive.
Mga?
Binibigyan ko siya ng kung ano yung decision niya.
Jehovah's Witness. Sino kilala natin ng artista na matay? Kasi ayaw niyang magpa-transfuse. Yun ang po ng Rene Requesta. Kaya nang ginamatay, severely anemic, you refuse transfusion.
Pag kunyari hinimatay siya,
Lost artist.
yun na yung advance directive.
Unable to take in food but the GI tract is functional, what do? We start patients on tube feedings. Meron ba terminally ill dito? Baka sakali lang. Wala naman siguro terminally ill. Pwede na siya nalang tanungin natin. Tube feeding. Some patients will refuse tube feedings. Kahit na very simple to do tube feedings. Patient develops respiratory failure. Before mechanical ventilation, we do intubation. So intubation involves putting a laryngoscope in the mouth, down the larynx, to the trachea, inserting a
Nakapagod na ako.
endotracheal tube to the trachea. Sometimes it's difficult because it tends to go to the esophagus. So dapat skilled yung mag-insert. And then we hope these patients do mechanical ventilators. So if PL refuse mechanical ventilation, pwede ba? Pwede. Kaya niya magpa-intubate. Pangatlong admission na niya eh. Their expenses are going up. She has 2 young daughters. Baka better to spend the money on her daughters. If PL develops hypotension or low blood pressure,
Imposible hindi niya nakikita.
we hope IV fluids, we hope inotropes, vasopressors to keep the blood pressure up. She develops bradycardia or slow heart rate. Ang ginagawa natin. Nag-BLS pa sa inyo. Sometimes we give atropine, sometimes we even do pacemakers. So transcutaneous pacemakers or intravenous pacemakers. Pwede gawin sa emergency room level yan. Temporary pacemakers. She develops asystole or pulseless electrical activity. Ano ginagawa natin? Hindi nag-BLS na. Basic life support.
Defibrillator.
Wala pa kayo next year pa. What do we do? Alam niyo naman yan. Pag-asystole, we do CPR. Cardiopulmonary resuscitation. We don't do defibrillation for asystole.
Wala nga.
Develops ventricular tachycardia or fibrillation. Ito na din defibrillate natin. Defibrillation, not like what you see in the movies or the TV shows na asystole ang patient. No heart rate, no electrical activity, then defibrillate. Para ma-jump start. We will do the defibrillation for ventricular fib or ventricular tachycardia. Develops renal failure. Dialysis. And dialysis is not easy. You have to insert a large bore catheter into a large vein. And the patient has to be lying down for several hours. So I got the advanced directive forms from some of the nearby hospitals. So this one from Cardinal Santos Medical Center. Checklist na lang. Patients, in case of cardiopulmonary arrest, call the code team, yes or no. Ganun lang kasimple sa Cardinal. Just check. Resuscitation, withhold or withdraw. Withhold means do not give it from the start. Withdraw, binibigay na, stop. So we have checklist for resuscitation, CPR, defibrillation, mechanical ventilation, and there are blanks for other specific orders. I don't like blood transfusion. I don't like hemodialysis. Stop all my medications. I don't care. Stop all my antibiotics. Stop all my medications. Stop my IV line. No more blood tests. So, pwedeng specify ng patient dun sa blank form. Sino nagsasign? I've discussed the above with my attending physician. Dapat doctor ang kumukuha ng advanced directives. Hindi pwedeng nurse, hindi pwedeng intern. Dapat siguro doctor. And I understand and consent to the withholding, withdrawing
nakita mo
treatment.
34.
Signature over for the name of the patient, date, and time.
Ang bilis na.
Doctor should also sign.
Naka-10 siguro.
Interpreter kung meron. This is from Cardinal Santos Medical Center. Also got the one from Medical City. I, name of patient. In the event of CPRS, ganyan-ganyan, understand. Then the next page, nandiyan. Do not attempt intubation, sign here. Do not attempt any form of electrical therapy to restart or stabilize the heartbeat. Defibrillation, pacing, or cardioversion, sign here. Do not administer medication to stabilize low blood pressure, such as vasopressor or inhalers. Or I request only medicines or therapies that control pain. Sa Medical City, ganyan din. Kung kayo makukuha sa patient ng ganyan, kaya niyo ba? Halimbawa, kaharap niyo si PL, will you be able to ask PL to please sign? Explain? Nag-lecture na kayo ng empathy? So are you confident na if you were faced with a patient who's terminally ill, who is refusing treatment,
Pero once yung body.
to discuss these matters with the patient?
Yung body ba? Yung ba? Like, yung ba?
So I need you to, from 2 points of view, from the patient and ask the doctor.
Okay, guys.
This one is from St. Luke's, do not resuscitate, we call it DNR, order. Order to withhold, withdraw life-sustaining treatment. In case of CPRS, call the code team, yes or no. So similar din, no? Resuscitation, CPR, defibrillation, intubation, dialysis, artificial hydration. Rational, kung kailangan.
Body bleeding pa kami.
Other specific orders, medical
Yung
facts.
gano'n kami fundraising na.
Pwede bang, ito, signatures lang, para ano sa card na.
Oh my God.
Can you change your advance directives?
Pinag-aagawa na ako.
May bago isip. Ay, gusto ko pa palang mabuhay, no? Papawian ko yung pinirmahan ko ng isang araw. Pwede? Pwede talaga. In St. Luke's, they even have a form for that. So, cancellation, revocation of do not resuscitate order. Pinirmahan na naman ng patient. So, it's never too late. Minsan may mga bulong patient na ganyan. So, DNR na malinaw. So, lumakit na, nag-deteriorate. Then, last minute, sabihin ng relatives do, kasi nakita na nahirapan ng patient. So, biglang babawiin nila. Do everything that you can. Again, binabawi namin yung do not resuscitate order. No choice. You have to follow what the relatives want. In the absence of a DNR order, do we do everything? Resuscitate? Defibrillate? Kung kailangan? Yes, it's our responsibility to. Unless talaga the hospital tells you na no funds ng patient niya, no further treatment. Minsan ang hospital nagsasabi na wala na closed account. So there's no more funding. Cannot give any more treatments. In the presence of an emergency, we're supposed to give everything that we can. In UERM, for some reason, wala tayong advanced directives form. Okay? Patients or the relatives have to write specifically in the chart. So ito yung kinuha ko. Yung date niya, kahapon lang to January 15, January 11 pa lang. I, son of blank, was informed about the condition of my father. We are aware of the possible consequences of his condition. I, together with my relatives, have decided that no resuscitation, intubation, medication to be done given in case his heart stops beating. Which is easier, the checklist or this one?
Checklist.
As a patient or as a relative, ano mas gusto niyo?
Checklist.
Kaya mo bang magsulat sa chart ng ganito? On your relative, on your father, for
Bakit
example.
wala ako?
Hirap, no? Pag doctor ka, mas madali yung checklist? O ito,
Checklist.
checklist pa rin. So I don't know why UERM doesn't have. Tinanong ko kay Dr. Gia, ano bang walang advanced directive form tayo dito sa UE? So baka kausapin niya yung kabila para maglagay na sila ng form. Dati may form yan. Kaya sabi ng residents, matagal nang hindi ginagamit. Ito ang parating ginagawa. This is a pay patient sa Salvador. Siyempre tinanggal ko yung pangalan. Other patient, I, blank. Yesterday din. I, blank, daughter of blank. After having been explained to and I understood about my father's condition, decide that we no longer consent to intubation or cardiac compression. We still allow the transfusion and giving of all medications. We consent to colonoscopy.
Ang hirap na.
So,
Paano ko marongga?
ganun ang ginagawa natin. So, when you become clerks,
Makahiya.
expect na baka ito ang gawin natin. Hopefully, magkaroon na tayo ng form. Mas madali pag may form talaga. Pati ako, gusto ko may form. Sometimes I don't ask patients to sign anymore. When I talk to the patients for the relatives and it's clear na DNR, sometimes I don't let them sign. They won't sue me naman kasi may usapan naman. Feeling ko naman pag medyo magulo na you really need them to sign it, alright, tell them to. Kasi it's a difficult task naman talaga for you to sign for your relatives. You might feel this guilt, konsensya ka habang buhay. It might haunt you for the rest of your life that I was the one who signed for my dad's PDR stamp. So sometimes it's hard. Sometimes we don't even ask patients to sign and just tell the nurses, pag nag-arrest yan, don't do anything anymore. Ako nang bahala. But preferably from a medical legal standpoint, we should have that form. So the guidelines would say, keep the originals in a safe but easily accessible place. Give a copy to your doctor. Give a copy to your healthcare agent and any alternate agents. Talk to your family members and other important people. Kung ambulatory ka pa, carry a wallet-sized card that indicates that you have advanced directives, identifies your healthcare agent, and states where a copy of your directives can be found. Keep a copy with you when you are traveling. So kung kayo, ayaw niyong ma-resuscitate kung sakaling ma-aksidente kayo sa daan, magdala na kayo ng advanced directives for sa wallet at sa bag. Ba, pamalin. So benefits of advanced directives respects individual autonomy. And the patient is responsible for his body and no one else can tell him otherwise. Avoids putting treatment decisions in the hands of others. So it makes it easier for the doctors also. Kasi binabantayan namin yung blood pressure pababa ng pababa. Mag-hook ba ako ng vasopressor? Papatawag ko na ba yung code card, yung code key? Mag-ready na ba ako ng standby na pacemaker? Pag sinabi ng malinaw naman na do not resuscitate, no preparations needed. Statistically significant reduction in health costs, fewer hospitalizations per resident, less resource use per patient, not associated with increased mortality. Helpful also for resolving disagreement between patients and their families about treatment options, making patients more physically and psychologically comfortable during the process of dying, opening up communication and trust among patients, their families, and healthcare professionals. So just some concern, minsan may lack of clarity. Okay? Before there were forms, like sa UE, minsan malabo yung explanation. So minsan yung order sa chart, no heroic or extraordinary measure in the event of terminal illness. Ang labo, no? So you still don't know hanggang saan ang ibig sabihin ng heroic or extraordinary measure. Ang vasopressor ba? Heroic na ba yan? Ang inotropes, heroic. Ang paglagay ng oxygen, intubate. So there's no cut-off. So it has to be very clear when we get our advanced directives. Possible interference with the practitioner's clinical judgment, adequacy and appropriateness of patient's information about their circumstances, type of intervention requested by patient. So sometimes for the physician, gusto niya maging aggressive pa sa patient because there are new treatments that will make this patient live longer. Even though the success rate might be low, 33% lang for example, gusto pa rin niya ibigay. Is there advanced directives? Kahit anong explanation sa patient, pinipili pa rin ng patient na huwag na lang ibigay. Some outcome studies, patients who have advanced directives were more likely to want limited healthcare intervention and palliative care. Kasi available na pala yung option na ganyan. If you go to Dubai, hindi pwedeng advanced directives. Bawal. All patients will get full sedation, mechanical ventilation, CPR, no matter what. Hindi ko alam bakit. In fact, if the nurses don't give CPR, criminal offense. Pag hindi nag-resuscitate ng I don't know why, sa Dubai, kwento ng mga nurses doon. Walang DNR form, walang advanced directives. So, all patients should get full treatment. And there's a question also about the applicability of the advanced directives. How early would we get it? For example, you have a patient na 59-year-old male scheduled for coronary artery bypass graft surgery. Elective, okay siya. Kung papa-opera lang siya kasi may mga blockages siya. Hindi man siya nagka-MI, detect lang sa screening, so maganda pa yung 2D echo niya. But we know that bypass artery graft surgery might have a small risk of mortality associated with it. Would you get advanced directives na? Baka matakot ang patient. Ito, hindi ko na yung tutuloy. Baka mamatay pala ako. Kapapirmahan mo pa. So would you get? Sa tingin niyo, who would get at the end of... Marami tayo matapos. At the end of this class, who would get? Somebody would get for an elective procedure? All patients? for this, for undergoing bypass, for all patients in general. That could cover this. Anyone else? Follow this example? Ano iba? Anyone say no, hindi kailangan. Tatakutin mo lang siya. Hindi na kailangan. Okay? About 27 female with pituitary adenoma scheduled for elective transsphenoidal surgery. It's brain surgery. They go to the sphenoid sinus and insert instruments through the nose to get a pituitary adenoma.
Yes.
Also probably a very small risk. Would you get advanced
risk
directives?
ba
27 years old, no? Bata mo. A little older than you. If any of you had to undergo brain surgery, for example, for a benign condition, pipirma kayo ng advanced directives? Despite all the assurance of your neurosurgeon, it's probably safe procedure. And what if in that small incident, no matter how good the neurosurgeon is, no matter how good the anesthesiologist, there is a chance na baka nag-bleed yung tumor mo sa loob. Hindi ka na magising.
Ano pumirma lahat?
Did you get?
Para shoot.
33-year-old female healthcare worker from Sierra Leone who has been febrile for 3 days.
Again.
Kukunan nyo na ng advanced directives. Baka dumugo ka ng dumugo. Hindi ka na makapirma mamaya. Kukunin nyo na ba? Ano yun naman significance ng Sierra Leone?
So, okay. Difficult patients or advanced directives? Parang something difficult.
Ano kumuha?
Bakit?
Meron, kasama siya sa mga
Kasi may old trends.
endemic yan. Liberia, Sierra Leone, Mali, etc. Kung ba kayo, healthcare worker yan, tumawag kayo ng baka positive for it. 78-year-old male scheduled for permanent pacemaker insertion. Generally, it's easy procedure. You just have to put a catheter in the subclavian vein, bring it down to the atrium and the ventricle, depending on 78 years old male, old. How about 72-year-old male diagnosed with Alzheimer's who has been deteriorating over the past years? Okay pa siya ngayon, nakakausap, still remembers, explain it, but in a few years, you might not remember anything. Did you get a proxy directive for this patient? Ideally, may question ka? Question ka? Tataas ka ng kamay. Ako may tataas. Ako may question. So ideally, you should get advanced directives for all of these patients. That's what they instruct. So advanced planning is good and should always be encouraged. Patients should have advanced directives that appoint proxies to act for them if they ever become incompetent to make their own healthcare decisions. The directive should also stipulate the sort of life-sustaining treatments patients would want to have withdrawn or withheld were they to become irreversibly comatose or terminal. Just in case you want to look for resources online, there's this one website called the Conversation Project.org. Nawala yung G, sorry. So, Conversation Project is dedicated to helping people talk about their wishes for end-of-life care. Baka meron sa inyo gumawa ng end-of-life